Meet Arafat, Hassan Ali, I am, Tanisha. They're the faces of a deadly measles outbreak.
Here in Bangladesh, it's been severe and hospitals like these are struggling to cope.
Lives upended by the force of the surge.
Measles anywhere is a threat everywhere.
Nearly 750 deaths in just 4 months.
We got no stock, sufficient stock was not there to go for vaccination.
How did all the progress in Bangladesh unravel so quickly and with such devastating consequences? A measles ward in Mymensingh. Hot, humid, overbearing. More than double the patients it can handle. Parents, their exhaustion, fear, heavy in the air. Beds, a bleak privilege. Only the most severe cases get one. 4-month-old Arafat is one of them. His parents' only child. He's battling pneumonia and heart failure.
When we first heard that a new disease had broken out, people in our village were crying in panic. I've cried so much that tears won't even come to my eyes anymore.
Another, Tanisha, 9 months old. Her immune system weakened, her skin infected, among other illnesses. She's been taken to 3 different hospitals, trying to find help. Doctors say this is more manageable than the peak of the crisis.
I have never seen an outbreak this huge in all my years of service. We questioned whether there was any weakness in our work or within our entire health team. If we get more space, another floor, or more rooms with an oxygen supply, that would be really good for us. It's frustrating because this was a controllable disease in our country, and the number of people who are vaccinated was very high.
Even if Bangladesh had made good progress towards eliminating measles, the sheer strain on this hospital shows you how quickly that work can be undone. And some families wanted vaccines for their children. They just couldn't find any.
Torn as she was put on life support. Baby Maliha's last bits of clothing. Mahfuzur Rahman and his wife tried vaccinating her at a local clinic a month before. They were told there were no vaccines. She died at just 11 months old.
Everything about her was wonderful. She was so calm right from the very beginning, from the moment she was born. The doctor asked, "Why did you make such a big mistake?" We explained we couldn't get the vaccine and that she had been sick. He said, "Look, now it's all up to Allah."
Others, more fortunate. 11-month-old Kainat, blissfully asleep. This jab may have saved her life, even if she doesn't like it. One of more than 18 million children vaccinated since April. Unicef claims delayed vaccine orders last year under the former interim government had caused shortages. They say this was their warning.
Whatever you are going to do, give yourself time enough to make the changes in the procurement mechanisms. We were worried about possible gaps increasing. We are speaking of a very highly dense populated country in which there were a huge movement of population at the same time. So it is many factors.
We reached out to a senior health official under the interim government. He denied any vaccine shortage and said while Unicef had raised concerns, these communications did not contain any specific warning about a potential measles outbreak.
Minister, thank you for your time.
Bangladesh's current health minister took up his post just a month before the outbreak, when the government was elected in February.
We are looking at the stock, how much stock we have We got no stock, sufficient stock was not there to go for vaccination.
We spoke to one family who had to leave a hospital because they said it was so overcrowded. They saw some families sleeping on the floor. Why was it that the hospital system wasn't able to
During
cope?
the first time, all of a sudden the burden of this patient, number of the patients went up. We failed to accommodate all the patients.
This was last week.
The first 15 days, but subsequently we made so many
The family
spaces.
we spoke to was last week, I mean. So what is the challenge here?
At the moment, the challenge is actually we have met the challenge already. There is no problem. We have so many isolation centers that the seats are vacant.
The World Health Organization says there's still a shortage in pediatric rooms, critical care rooms, isolation rooms. They say there are still thousands of unfilled healthcare worker positions.
Yes, we have a large number of patients, large number of population. The accommodation facilities are comparatively low, but we have managed by this time.
We're on our way to another hospital in Dhaka to see what the situation is there. The World Health Organization has this saying, measles anywhere is a threat everywhere. There have been measles outbreaks in multiple countries around the world. The United Kingdom had eliminated the disease altogether but lost that status in recent years. The United States has seen a rise in measles cases. Health officials here keep telling us that it's clear measles vaccines work and that when they're missed, it's children who pay the price.
Facing overcrowded hospitals near their villages, the families we meet here have travelled hours to reach the capital. Ayam is only 4 months old. His parents first noticed a rash over his face and eyes, making it difficult for him to open them. So, they made a 12-hour journey here.
We came by ferry. There were so many patients outside that we couldn't get a bed. Realizing how critical his condition was, I absolutely needed to get him admitted. We came back and they gave us a bed in the afternoon.
Despite these scenes back in Mymensingh, officials say cases are slowing. Still, every day, there are nearly 1,000 new cases. Days after our visit, we learn baby Arafat has died. A reminder that children are still dying from a preventable disease. Azadeh Moshiri, BBC News, Dhaka.